Inpatient care. This is me. We got another. Oh yeah. This is you.
Pull out your phone.
Question.
So I'm DPC and already do inpatient care. I'm DPC and don't do inpatient, but I would like to. DPC and do inpatient care or want to do inpatient care, but I have some obstacles. Not DPC, but will do inpatient care if I can figure out a way, and not DPC, and I don't want to do inpatient care after I start. Oh, you're killing us. Okay.
I'm going to try to convince the 28% of you that don't want to that you should want to. We're going to do this opinion survey. You don't need to click in on this one. Just raise your hands. You believe, A, DPC docs can do inpatient better than hospitalists because of time availability and increased continuity. Okay, very good. You think hospitalists can do better than DPC docs inpatient because they do it all day long for a living, which I believe somehow compensates for crappy continuity. It's almost like they think the question's biased and they all voted for A.
So we are clearly biased. So we do inpatient care. We think that this is a huge value add to your patients. But once again, this is the right thing to do. You know the patient. The hospitalists don't know the patients. Like, they don't know them. They don't know their history. They don't have years or lots of time with this patient where they've seen them in the outpatient setting and know the progression of the disease that they have that required them to be hospitalized. Also, if you haven't noticed, hospitals are terrible places to have coordination of care performed. Did you ever, has the hospitalist ever called you up to ask you a question about a patient? No.
In your career?
No. Right? Is this true? Yeah. In addition, hospitalists aren't the only ones with up-to-date, right? So you have up-to-date just like they do. And even if you haven't been in the hospital for forever, you got up-to-date. Read up on a condition, and if you got somebody in the hospital and you need a specialist, hey, you can consult them. And if you're already in the hospital doing social work rounds, why not just manage the patient? So this is something that is pretty easily done, and the patients are going to be texting you anyway, asking you all their questions. You're going to be coordinating all their care. You're going to be keeping the hospitalist in line. So why not just see them yourself?
That'll stay on this slide. So
Sure.
Anybody here not ever had the experience where after your patient gets out of the hospital, they come back to you and they have no idea why they were there, what was done. You have no follow-up paperwork. You didn't talk to the doc, right? Okay, even worse. And this one has made me damn near homicidal. Have you guys ever been on that phone call with a hospitalist because you are holding your hospitalist feet to the fire? And so all the hospitalists, so I do my inpatient care in Holton, but sometimes I'll have somebody that needs something that's in a bigger city, like they need a heart cath or whatever. And so I'm having to deal with the hospitalist remotely, and I talk to them every day, and they are terrified of me. Like, I am the attending, and they are the first-year resident in Topeka, where most is a hospital. Because if they are checking out a patient who's transitioning back to me, I'm going to pimp the crap out of them. Because the first time this ever happened to me, this hospital, this poor person, I mean, he probably had 30 patients, and he'd probably been on the shift for 4 hours. He doesn't know who's who, what's what. And I've already read all their labs and everything because I got it on the EMR or whatever, or on their portal or something. And I'm like, what about that hemoglobin of 6.2? Are you sending them home with that? What about that creatinine of 2.9, whatever? And they're like, and I mean, I just ripped, oh my God. And so now, whenever a hospitalist calls me, I'm telling you, you can tell. They're like, oh yes, and their creatinine was 1.9. they're ready, So my point is, if you've had that, you go, these people are caring for my patient? Mm-hmm. These people don't know, they don't know. I mean, okay, you got it, right? I'm passionate about this.
You're doing DPC because you love your patients, right? You care about them deeply and you want them to be well cared for. That's why you're doing this. This is a way to really care well for your people.
I tell those hospitals, I'm like, if this was your mom, I bet you would know her creatinine. And you got to treat my patient just as good as her.
Yep.
Pisses me off.
Yep. So we understand that there are definite barriers to getting back into the hospital. So many of you have left the hospital because you were burned out of it and it wasn't something you wanted to do. So getting privileges again can be difficult. It's usually, especially if you're just coming out of residency, get your privileges then and maintain your privileges. If it's something where you may need to be board certified in order to get privileges at certain hospitals, you can be board certified with several different organizations. Sometimes there's turf battles or administrators that don't get Medicare-related things. I'll let you kind of...
Well, the thing about administrators is that they don't understand all this stuff, and so they just say you can't do it. And so what this is, and many of you have heard me talk about this before, but this is the Walmart employee. Whenever you call Walmart or whatever store, and you're like, "Hey, do you guys have whatever in stock?" No. They don't know. They just went through this mind. This is what happened in that, like that high school dropout's brain whenever you ask that question. Okay, they want to know if we have, whatever, size large socks that have red stripes. Or, I don't know why you would want that. But anyway, I'm going to have to walk all the way over there to the sock department and then look. And then I get paid $8 an hour, and I get paid the same whether I do this or not. No, we don't have that, right? That is exactly what a hospital administrator does whenever you try to say, I need to have privileges at your hospital and I'm opted out of Medicare. You can't do that. Yes, you can. They just don't know. They've never had anybody ask them, and they're too lazy to do the work. Keep in mind, you're going to make money for their hospital. They should be like, let me figure this out. Yep. No, they just go, no, that's different and scary. Okay.
Yeah. This also may require you to have different malpractice. So your malpractice may be slightly more expensive. My malpractice is about twice as expensive, but still very affordable. But that's with OB inpatient overseeing residents. So how do you get your foot in the door? So the first thing is you just have to go for it. You got to push a little bit. Apply for privileges. See if you get them. If you need to be precepted a little bit, make it happen. You can also moonlight at smaller hospitals potentially, cover ER shifts to kind of get your foot back in the hospital side. There are different groups, especially if you have multiple practices in your location. Start a call pool and see each other's patients in the hospital. You can also, so this is one of the ways that I do this, is I teach for a local residency. So I get to train young doctors and tell them about direct primary care and why this is beneficial, or do you know how much that medicine is, and do you know what we can do in the office with this person? But I also then get to do inpatient care and help to train residents from that standpoint.
If you've got a hospital that's trying to make it hard for you to get privileges for whatever reason, I know there's like university hospitals where you pretty much have to be on, full-time staff. There's going to be pretty rough barriers like that. But in general, at a hospital where private physicians should be able to have privileges, if they're making life hard for you, they hate negative press. Just threaten them with it. Say, listen, I would love to go to the newspaper and tell them, if I understand this right, that you're saying a doctor in this town cannot take care of his or her patients in your hospital. I just want to make sure I'm getting this right. So when I'm talking to the editor of the editorial page, I get the quote right. Is that right? We can maybe figure something out. Come on.
Yep.
So let me take care of my patients, especially if you can put together a packet with the last 10 malpractices that their hospitalists did to your patients, which will be the last 10 admissions, by the way. Okay? And say, here's what they did wrong. I don't do crap like that. I think it's probably better if I take care of them. And then how they argue with that. Yep. You've got the upper ground on that.
Or call one of us and we'll help you argue.
That's right. Stick me on them.